Some aging adults have health problems that make it difficult for them to continue to live in their own home. In this video, you will learn about alternative housing and support options that may be appropriate for these individuals. Trying to collect and understand the available information on these alternatives while you are also caring for a family member can be time-consuming and difficult. Our hope is that this video will give you some basic facts and guidelines that will assist you with this process. There are 3 levels of community living available to today's seniors. There are independent senior living communities, assisted living communities, and long-term care facilities. Which level of care is most appropriate for your family member depends upon his or her care needs. How much care and assistance an individual needs depends upon how many activities of daily living the individual is able to perform safely without assistance. When health professionals talk about activities of daily living, they sometimes shorten it to ADL. So if you hear someone say ADLs, you should know that it stands for Activities of Daily Living. Activities of daily living include things like walking, bathing, dressing, and eating. Another important activity of daily living is the ability to transfer. That is, the ability to move from a bed to a chair or from a chair to a standing position. These are the kinds of questions the members of the medical team are going to ask to figure out how much help your family member needs. Can your family member walk without help? Does your family member walk without help if they use a device like a cane or a walker? When using that device, do they also need someone gently guiding them? When using that device, do they also need a lot of assistance from another person? The general guideline is the more assistance a person requires to accomplish ADL safely, the higher level of care the person needs. Independent living senior communities, also known as retirement communities, are designed for seniors who are completely independent in their own care. This means they can do basic household management. They are usually physically and socially active and have few serious medical problems. Meals are usually offered in a community setting. Many seniors drive, but usually these communities have a shuttle bus available to take residents to nearby shopping areas, restaurants, and doctors. There may or may not be a 24-hour nurse on the premises. In most independent senior living communities, the residents pay for it with their own money. Usually there is a community entry fee and then monthly rental fees. For seniors with low incomes, there may be a government-subsidized senior housing development in the area where they wish to live. Assisted living facilities are designed for those seniors who can no longer safely live independently in their own homes, yet do not require a high level of care. These seniors should be able to walk or move about on their own using a device such as a cane or walker if necessary, or be able to move themselves in a wheelchair at least 150 feet. Assisted living facilities will provide help with medication management, a limited degree of nursing assistance, help with meals, and organizing social activities. Many assisted living facilities also have a separate unit for individuals who have been diagnosed with dementia. There's another video in this series that can provide you with more information on dementia. Most residents at assisted living facilities pay with their own money. This can cost approximately $6,000 to $8,000 a month, depending on how much assistance a resident needs. Some assisted living facilities will accept Medicaid for those residents who eventually use up all their funds. Some facilities want their residents to provide a year or 2 of private payment before accepting Medicaid funding. Usually, if an assisted living facility accepts Medicaid, they allow no more than 10 to 20% of their residents at any given time to have Medicaid as their primary payer. If there are beds available, occasionally an assisted living facility will accept a resident with Medicaid directly from the community. You will need to call or visit assisted living facilities in your area to get information about their policies for payment. Medicare, which is based on age, not the individual's financial resources, does not pay for assisted living. Long-term care facilities, also known as nursing homes or nursing centers, are designed to provide the highest level of care to the frail elderly. Here, the residents will have 24-hour nursing care necessary to safely manage their complex medical issues. Most of the residents share a room unless they pay an additional amount to live in a private room. Residents are encouraged to eat their meals in a central dining room, but a resident can choose to eat in their room as well. All facilities have organized social events, family events, and various forms of entertainment. If an individual is paying for the long-term care facility from their own money, it will cost approximately $9,000 to $11,000 a month. Medicaid and, under certain circumstances, Medicare may sometimes contribute to the cost of care. To summarize, finding the best care for your loved one requires careful evaluation of your family member's medical, personal care, and social needs. The options available depend upon the person's health situation and whether they will pay with their own funds, insurance funds, Medicare, or Medicaid.